Well, I'm Dale Newman. I'm director of the Harry S. Truman Center for Government Affairs at UMKC, and we are pleased to co-sponsor this program this evening with the Greater Kansas City United Nations Association, and obviously with the organizations that have brought to us the panel of speakers that we're going to have. I also want to thank the Kauffman Conference Center for providing this nice facility. As long as we behave ourselves, it's free, and so I like to use nice facilities. I promise we'd behave. Let me get to our speakers, because it's an interesting panel of speakers. Well, first, I'm going to introduce our moderator, Jay Svaren of Greater Kansas City United Nations Association. He's going to take over as soon as I get done introducing folks, and he will make sure you have a productive afternoon. Coming to us from New York, Lynn Stratford is the Senior Vice President of Program and Strategic Partnership and oversees the U.S. Fund for UNICEF, work with U.S.-based non-governmental organizations, educators, school children, campus groups, and other volunteers. Lynn is also responsible for helping ensure program coherence between UNICEF and U.S. Fund staff in areas related to child survival and development. These include healthcare, nutrition, clean water, sanitation, education, and protection. Previously, Lynn served as Chief of Staff at the U.S. Fund for UNICEF, where she was responsible for working with the Board of Directors and staff across the organization, managing the organization's strategic planning process, the Management Council, and the U.S. Fund's annual meeting. Lynn has been with the UNICEF family since 1991. From 2002 until 2007, she helped create and manage UNICEF's global campaign on children and AIDS. She has worked with UNICEF in New York and various country offices. Her positions in the U.S. Fund have included Director of Marketing and Development, Special Assistant to the President, and Assistant Director of Communications. Lynn is a graduate of Catholic University of America with a degree in International Relations. This may not be the order in which they speak, it's the order in which the papers were given to me. On our panel is Kenny Harris, Rotary International. Kenny has been a member of the Blue Springs Rotary Club since September 1984. He served as president in 2008 and 2009, and previously has held the positions of secretary and treasurer. Kenny is a multiple Paul Harris Fellow, has been named Rotarian of the Year of the Blue Springs Rotary Club. He's attended 4 Rotary International Conventions and 3 Rotary Zone Institutes. Kenny grew up in Osborne, Kansas, where he graduated from Osborne High School. He was active in football, basketball, and track. Summers were spent helping his father in a small community repair shop and then farming in the evenings. He attended Garden City Community College, then Fort Hays State University on a football scholarship. Kenny is married to Donna, and they will celebrate their 40th wedding anniversary the 29th of July. They did this past year. They spent 10 years in Topeka, Kansas before moving to Blue Springs. Kenny and Donna have 4 children: Trevor, Amber, Ashley, Tyler. Currently, Kenny and Donna have 5 wonderful grandchildren. They are active members of St. John the Land Catholic Church, where they involve numerous parish ministries. Kenny has long been affiliated with several trade associations, serving as treasurer, secretary, and president of the Associated Rental Stores of Kansas City and of the Missouri Rental Association. In 2000, he opened his current equipment rental business, Oak Grove, Missouri. Kenny's hobbies include fly fishing, fly tying, water sports, snow skiing, high school, college sports, Kansas City football. I think he needs more hobbies. Kenny. Donald Knipp, International Director, is from Avaz, Missouri, USA, was elected to serve a 2-year term as a director of the International Association of Lions Clubs at the association's 95th International Convention held in Busan, Korea, June 2012. Director Knipp is a retired manager in the refractory industry and owner-manager of a small retail grocery store. A member of the Avaz Lions Club since 1968, he's held many offices within the association, including club president, zone chair, region chair, and district governor. He is a certified guiding lion and has also served on the Missouri Lions Research Foundation and is the chair of the MD 26 State and International Convention. In recognition of his service to the association, he has received numerous awards, including 5 district governor certificates of appreciation, 4 international president certificates of appreciation, and the International President's Leadership Medal. He is also a Melvin Jones Fellow. In addition to the Lions activities, Director Knipp is active in numerous professional community organizations, including honorary board member of the Missouri Lions Eye Research Foundation, deacon treasurer of the Grand Prairie Baptist Church, and member of Gideon's International. In the past, he's also served as the Avaz mayor and councilman, president of the Avaz Community Center, and received the Avaz JC's Distinguished Service Award. Director Knipp and his wife Betty, also Melvin Jones Fellow, have a son and daughter. Director Knipp. And finally, Gary Goebel. Gary Goebel has lived in the Kansas City area all of his adult life. He and his wife Ellen have 3 daughters, Audrey, Charlotte, and Clarissa. Gary's profession is in the area of commercial and investment real estate sales. He is a certified property manager and past president of the KC Institute of Real Estate Management. As a member of the North Kiwanis Club, he has served as Distinguished Club President, Distinguished Lieutenant Governor, and Chairperson of the Metro Kiwanis Council from 1994 to 2005. In 1996, Gary was Chairperson for the Kansas City Waste Minimization Commission. During 2010, he worked on the Kansas City, Missouri School Strategic Plan Committee and campaigns for Derek Ritchie and Colleen Carroll, both elected to the Kansas City School Board. And lastly, Gary's major vice is he's an avid golfer.
Okay, it's going to be a very simple program. What we would like to do is stress the need for partnerships in saving children, and we have organizations here who are involved daily in doing just that. We'll start off with Lynn Stratford of UNICEF, who will discuss, the UNICEF approach to partnerships. And then after she has given some comments, I'll get up and introduce the next speaker down the line. And at the end of the discussion, we would encourage you to ask questions and present observations if you do, because we're here to learn from one another. All these organizations do fantastic things. They're organizations that are active in our community, but sometimes we don't know what each other is doing. Sometimes we don't have a community understanding that would be beneficial to these projects. And so we hope that this program will begin to make some headway in bringing this out to the general community so that we all derive support for these great missions. So I'd like to introduce Lynn Stratford.
That's on, yeah. I was planning on doing this through interpretive dance, but I think we've had enough excitement. I have been with the organization for close to 21 years. Sometimes that's hard to say out loud. But if you ask my mother, she will tell you that I have worked for UNICEF since I was 6 years old, because that was the first year she handed me an orange carton and asked me to trick or treat for UNICEF at Halloween. And it just instilled this lifelong passion for, one, for the organization, but two, for this concept that in every small way and in every large way, we each make a difference. And so I just wanted to thank you so much for the invitation to be here, and thank you all for being here as well, because it's just so great to have an opportunity to talk about this great work for kids that I think we're all passionate about and all interested in. When I first joined the organization 21 years ago, 33,000 children died every day from things that we know how to prevent. That's 33,000 children under the age of 5. Every single day they died from measles, they died from polio, they die from malaria, they die because they lack clean water, they die because they're locked out of an education. They die for a number of reasons. These are all things we know how to prevent, and they're things that do not cost a lot to prevent. But what it really requires in tackling any issue is political will and groundswell. And so it has always been UNICEF's philosophy that we can't ever do anything outside of partnership. It is partnership and true partnership that literally moves the needle on any issue that we want to tackle. And it's always been UNICEF's philosophy that while poverty has always been with us, it doesn't always need to be. It's just that we've never collectively thrown our weight behind it, and all of the things that means for kids. And so it's been an extraordinary 20 years to look at the progress for kids. That 33,000 a day, as of this year, is down to 19,000 a day. So, and this is while the world's population has tripled. We've managed to bring these numbers down, and that's extraordinary progress, cutting it that far. But 19,000 every day is still 19,000 too many. So we have a long road ahead of us. And when I say us, I mean us, all of us, because each one of us has a part in this. There's been some other extraordinary progress, just so that you know, that so many partners have helped make possible for kids, so that you have context. It's not just about child survival. It's about specific issues that kids face. So in the last 20 years, school enrollment for kids has actually doubled, which is extraordinary. 2 billion people, 2 billion, have been given access to clean water over the last 2 decades. The number of maternal deaths, women who die because of complications of childbirth, while still unconscionably high, has actually been cut in half in 20 years. The portion of children who are born underweight has been slashed. Cases of polio, which we'll hear a little bit more about, have been slashed by 99%. We're down to the last 1% of cases of polio in the world, and it will be literally wiped from the face of the earth, thanks to one of the partners at this table and so many others. And measles in particular as well. We have slashed that 78% since the early 90s. So extraordinary things underway and extraordinary issues that we have tackled together, because not one of us can do it alone. With the help of partners, the scope of these things are huge, but through partnership we make it manageable. We take it piece by piece and actually figure out how to bite off bits of it and make it manageable. So we know exactly how many malaria bed nets we need. We know exactly how many vaccines we need to get in production. We know exactly how many healthcare workers we need to train. And it's with partners in this approach on the ground that help us identify those needs, help us figure out how to resource, how to fund what's needed to be done, and then figure out how we're going to get it done. And it's extraordinary, not just from a program perspective, what we actually do for kids, but from an advocacy perspective as well, because it's our jobs collectively every day to go out and advocate for kids and to knock on the doors of every government around the world, including the US government, and say, but have you counted kids today? How does it work in? How does it figure into your plans? Are kids truly a part of your planning? And this is how we put the face of children on a lot of the issues that, public health issues around the world. In particular, there are three extraordinary partners who I'm honored to be at the table with this afternoon. And let me just give you a quick snapshot of what that's even looked like over the last 20 years, because we've done some pretty great things. We have a long road to go, but really great work together. Kiwanis International, a few years ago, they took on iodine deficiency disorders, which were then the leading cause of mental retardation in the world, and said the simple thing of iodizing salt, we can help make that happen. And iodine deficiency disorders have virtually been eliminated. They no longer exist as a public health crisis, and that is because Kiwanis put the resources and the capacity and everything we needed on the ground to help us get this done. And now we're very proud to be partnering with Kiwanis again on eliminating another public health crisis, and that is tetanus, something we all take for granted. Step on a rusty nail, we know where you're going first, right, to the doctor. But yet tetanus kills thousands of mothers and children every year, and we are driving together the idea that we can eliminate tetanus, and that means that 100 million women need to be vaccinated still against the disease in order to do this, and we are on the road. We have 26 countries that have announced elimination. Lions Club International has taken on a number of global issues, including river blindness, which is a disease that exists primarily in West Africa around fast-moving riverbeds and flies that carry a parasite that literally cause blindness. And Lions has taken that on with passion, and we're down to a handful of cases. They've also taken on this great project with UNICEF on School in a Box, and it's this innovative, literally a box that we can transport that has enough educational materials in it to teach 80 kids at a time for a year of school when they have lost it due to crisis, due to natural disaster, or simply because they live too far from a school setting. And so we provide portable school boxes so that kids have a shot at an education no matter where they live. And Lions has been a terrific partner on that. And it had been around for a while, and it wasn't until Lions came on the scene on School in a Box that literally opened up the doors for the access to get the school boxes around. And I think they cost $180 a box. It's really phenomenal. And now Lions is taking on this measles fight, and it's going to help us push the last way and the last distance. While we have reduced it by 78%, that remainder 22, if my math is good, it will be thanks to Lions. On the vaccine front, there's so many important players, but Rotary International has taken on polio eradication for 20 years. I think there's 1 million Rotarians who've raised $900 million and who do the work on the ground as well and have helped us get to this point. The last 1% are the hardest to reach. They're the most mobile. They live in the most difficult circumstances, and yet we're literally on the verge of polio eradication. And so it's been, I think, an extraordinary adventure for both of us to be at this point now. And these are just some of the partnerships. Dr. Pardo's in the audience, who's a member of Zonta International, one of the largest women's service organizations. And together we are tackling the prevention of mother-to-child transmission of HIV and AIDS in Rwanda. And it will be among the first countries where we can literally say there will be a generation born HIV-free. And that's an extraordinary accomplishment. But again, it could not be done without the passion and the commitment and all of the resources that Zonta brings to bear. I think that, just to wrap up before I turn over to some of my other colleagues, partnership is in our DNA at UNICEF. We couldn't possibly operate any other way, and we do it at every level. We do it here in the United States with all of these extraordinary organizations. We do it with school teachers and Boy Scouts and Girl Scouts and all kinds of people. We do it with members of Congress. We do it in every way, shape, and form that we can to get the word out, to get America on its feet, to understand the issue of children, and to actually take action to help us toward the day when there are 0 children dying of preventable deaths. And at the country level, where the world's poorest live and the hardest to reach and the most marginalized, we work with families. They are our first partner, with communities, with local governments, with national governments, and with the most diverse group of partners with any specialty interest that we can find to help us reach all of those hardest to reach, because literally, we just don't have the capacity alone to do that, and our voices together are so much louder than they are by themselves. And so it's been, it's just such a fundamental part of who we are and how we work, and all of this progress for children is because partners like Rotary, like Lions, like Kiwanis, like Zonta step up and take on an issue with passion. So we're just truly pleased to be here.
Thank you. And we'll call on Gary Goebel of the Kiwanis. I'll help you set up this thing here. Just hit this thing right here, right? Anytime you're ready. Very good. Thank you. Thank you.
Well, thank you for the invitation to speak with you today about Kiwanis. Kiwanis is a worldwide service organization dedicated to improving the world one child and one community at a time. Our organization was founded in 1915, and the word Kiwanis is a Native American word. Our founders interpreted it as we build. Our current motto for Kiwanis is serving the children of the world. In the Kansas City metropolitan area, there are approximately 30 clubs, and we total some 900 members. One of our annual citywide projects is called the Mother's Day Baby Shower. On the Saturday before Mother's Day, for approximately 6 hours, we collect baby products at local grocery stores. In total, we will collect about approximately $30,000 worth of baby products this year. In 2013, the date is May 11th, so be sure and write that down. Another major emphasis of our clubs are the scholarships that we give to high school seniors. Each year, we donate approximately in the local area over $50,000 for students entering college. I'm here today to share a little bit about our involvement with UNICEF as we are working towards the elimination of maternal and neonatal tetanus. To celebrate Kiwanis' 100th birthday, we are pledging $110 million towards preventing the deaths associated with this infection. At this time, I'd like to show a 6-minute video, and I hope it's not too graphic. All right.
few events more joyful than the day a new baby is welcomed into the world. But in over 30 countries, a dreaded disease quickly turns that joy into tragedy. Tetanus is as ancient as history itself, even referred to in the Old Testament as the seventh-day death. It cruelly and swiftly steals children from their parents and mothers from their families, all in the first week of an infant's life. It is caused when tetanus spores found in soil everywhere come into contact with open cuts during childbirth. Death is agonizing. Newborns suffer excruciating convulsions and extreme sensitivity to light and touch. The disease strikes the poorest of the poor, the geographically hard to reach, and those without access to health care. Maternal and neonatal tetanus, or MNT, kills nearly 60,000 newborns each year, and mothers may die as well.
As a mother, I can't imagine having a child for 3 days, 4 days, and having it die.
Even more tragic, these deaths do not have to happen. A life-saving and affordable vaccine that prevents MNT has existed for decades.
It's unacceptable to see a disease which had disappeared from the developed, industrialized world to still occur in developing countries when we have a solution.
Lucinda Pedro was forced to flee a refugee camp outside Luanda, Angola, when civil war broke out around her village. It was there that she gave birth to her son, Alfonso Domingos. After her baby was delivered, his umbilical cord was infected and the deadly MNT symptoms began. And 1,000 miles away, another parent sat anxiously while doctors tried to save her son, Mamusha's life. The baby's mother, Itanesh Base, never got her vaccination because she lived in a remote, difficult-to-reach region in Ethiopia. Education, outreach, and mass immunization drives are the key. Even in rural, highly remote areas, UNICEF organizes the transport of vaccines by any means necessary, even by horseback, in order to reach every woman of childbearing age. And the mothers do their part, walking miles to get the vaccines that will save their future babies' lives. UNICEF also trains traditional midwives in safe birthing practices and distributes safe birthing kits to prevent MNT from claiming more lives. Inroads against MNT have been made, but the disease still kills one baby every 9 minutes. That's 160 families every day who will suffer the loss of never seeing their child grow, play, learn, and smile. But this disease has now met its match. Kiwanis International and UNICEF have formed a powerful partnership, the Eliminate Project, to end MNT. Kiwanis International's commitment, vision, and reach, combined with UNICEF's expertise and experience, are a sure combination to reach these neglected, unserved families and stop this devastating killer forever.
If you have your first pregnancy and you have 3 vaccines, it'll get you through so that you won't get neonatal tetanus and your baby will not die. It's just something that's passed on, but it's so easy to prevent.
We have the ultimate weapon against this killer disease, a safe and effective vaccine. One tetanus immunization costs just 60 cents. Now we need just one last push to wipe it from the face of the earth and save these babies and mothers who are senselessly dying.
It's possible to eliminate a disease worldwide, and in the countries that are currently still facing this problem, there will be thousands and thousands of children who will be allowed to live.
UNICEF and Kiwanis has one major commonality, and that's serving the children of the world.
The Kiwanis-UNICEF partnership is exactly the far-reaching strategic initiative that will save these babies and mothers and end this tragic waste of human life.
I really, truly believe that this Eliminate project will save thousands of lives.
The Eliminate project will change the course of history.
Over 100 million mothers and their babies are still at risk in over 30 countries around the world. But with the Eliminate project, these lives can be saved.
I'm really proud to be part of this project. I've seen the tangible results of what we're doing. I've seen the mothers walk out of the clinic. They're really happy that they're doing that for their children. So for me to be a part of this, it's a real opportunity, and I'm really excited to be here.
No family should ever have to suffer the anguish of watching a child or mother die from tetanus. And when Kiwanis and UNICEF join forces to eliminate MNT from the face of the earth, one day soon, no family ever will.
Kiwanis is grateful to participate with the UN and UNICEF in this Eliminate project. You too can help. When you see local Kiwanians holding chili day suppers, pancake breakfast, or collecting baby products at the Hy-Vee, please support us. Together, we can eliminate maternal and neonatal tetanus. Thank you.
Well, thank you very much for having the opportunity to come and talk about our program that we're getting into, the Lions, our One Shot, One Life Measles Initiative. Thank you very much for this opportunity to come here to Kansas City to this UNICEF program and just tell everyone how much we appreciate being a part of this great program that we have. And we're going to solve the measles epidemic around the world. It's going to be gone just pretty shortly, people. You can just take my word for it. You know, 380 children die each day from measles complications. And of the children who survive, nearly 30% suffer complications such as vision loss, hearing loss, brain damage, pneumonia, vitamin A deficiency, or encephalitis. Measles is also extremely infectious. If we introduced measles into this room, and none of us had been vaccinated or had immunity to it, 90% of us would get the disease. We would just, it would happen that quick. And, but we're working on this. LCIF, or Lions Clubs International Foundation, is an official partner of the Measles and Rubella Initiative, formerly the Measles Initiative, a collaborative effort of the World Health Organization, the United Nations Foundation, UNICEF, the American Red Cross, the U.S. Centers for Disease Control and Prevention to reduce the number of measles-related deaths. The Measles and Rubella Initiative is considered one of the most cost-effective partnerships in the history of public health. The Measles Initiative was launched in 2001 on the premise that any death from measles is one too many. At that time, measles was the single largest vaccine-preventable cause of death among children. Partners provide technical, financial, and grassroots support for vaccination campaigns. By combining resources, the Measles Initiative achieved great results in its goal to eliminate measles. Over 1 billion children have been vaccinated. Children in more than 80 countries have received vaccinations, reducing measles deaths by 90% in nearly all countries. In April 2012, the Measles Initiative changed its name to the Measles and Rubella Initiative, and the new name fits its global strategy of targeting rubella and congenital rubella syndrome along with measles through one combined vaccination. The Measles and Rubella Initiative has strong support from the Global Alliance for Vaccines and Immunization and is welcoming new partners, including the American Academy of Pediatrics, the International Pediatric Association, and Sabin Vaccine Institute. Up here is a more complete look at the partner organizations involved in the Measles Initiative. And as you can see, the Lions are the only service club organization involved in the initiative. In 2010, the Gates Foundation provided LCIF with a grant of $400,000. The Lions matched these funds with $300,000 for a total of $700,000 for measles vaccination campaigns. A portion of these funds were awarded to Lions in 4 pilot countries: Ethiopia, Madagascar, Mali, and Niger. The funding was used by the Lions in the 4 pilot countries for use for advocacy, planning, and social mobilization. Now, why target the measles? As we were talking about as we started, 380 children die each day from measles complications. In 2000, about 45.5% of vaccine-preventable deaths among children were caused by measles. Now that you know some facts about the disease, let's answer this question. Why should Lions and their international partners target measles? First, measles is one of the leading causes of death among all vaccine-preventable diseases. In 2000, almost half of vaccine-preventable deaths among children were caused by measles. Currently, this percentage is lower, but still 380 children die each day from measles complications. Second, the measles vaccine is extremely safe and effective, and it provides lifelong immunity. Additionally, the vaccine is cheap and easy to administer. Also, as we've already learned, measles can lead to serious, lifelong adverse health conditions. For many children, measles is not just a childhood disease that they will recover from. It's a devastating condition that can affect them throughout their lives. Measles affects the entire family, not just the child who catches it. Families are impacted through lost work, when a parent has to stay home to care for a sick child, through hospitalization fees, and through long-term care fees, should the child develop any of the serious side effects of measles, such as corneal scarring. International organizations have been working to eradicate measles since the early 1980s because it affects populations in every region of the world. The fight against measles will also strengthen other aspects of health care in the developing world. In particular, primary health care and routine immunization will be strengthened through investments made in measles vaccination campaigns, such as improving infrastructure, training healthcare workers, and strengthening general health care delivery systems. Measles is ripe for eradication. Native measles has already been eradicated in the Americas. The only cases currently affecting North and South America are imported from other countries. Using the same methods, the Measles Initiative is hopeful that measles eradication can be extended to the rest of the world. Currently, measles still affects every region of the world, either through native cases or through importation from another part of the world. Getting rid of measles would help improve the quality of life for families. It would be one less thing that parents would have to worry about. Measles can be imported and spread even in areas where indigenous measles has been eliminated, and this is what happened in the Americas in the last year. Infection can spread from unvaccinated people in developed countries to communities in Africa and Asia that are more vulnerable. Both the United States and Canada have battled major measles outbreaks in recent months. Additionally, Europe was recently warned to redouble anti-measles efforts after suffering more than 26,000 cases in 36 European countries between January and October of 2011. More than 83% of these cases were in Western Europe, and 90% of those who contracted measles were either unvaccinated or did not have a vaccination history. Additionally, the outbreak in Western Europe has been linked to outbreaks in other countries, including Brazil, Canada, Australia, and the United States. Now, luckily, many European governments are reacting swiftly to this threat. France, which suffered the largest outbreak with 14,000 cases, has launched a nationwide communications campaign to raise awareness about the need for measles vaccinations. The Lions' role in advocacy for measles immunization has been and will continue to be important at the local, regional, and national level. Lions have participated in forming a committee and opening an office dedicated to Measles Initiative activities, meeting with the World Health Organization and local public health representatives to determine gaps in the campaign plan, and strategizing solutions to fill gaps and ensure the world that the most vulnerable areas were reached. As I mentioned earlier, Lions are very important to measles campaigns in the area of social mobilization and public relations. One critical component of any mass vaccination campaign is ensuring that the families participate and have their children vaccinated. Lions played a key role in getting the word out and bringing families in during the days of the campaigns. This is not the first time the Lions have been involved with these activities. Lions have conducted social mobilization campaigns for trachoma, cataract surgeries, and diabetes awareness, and have been very successful at it. During the 4 pilot campaigns carried out in 2010 and 11, Lions assisted through TV and radio ads, posting and distribution of flyers, mobile public service announcement messages in targeted neighborhoods, creating and distributing promotional items such as t-shirts. With the help of the Lions, these campaigns were very successful. Not only were more than 41 million children vaccinated in the 4 pilot countries, but also healthcare infrastructure was greatly improved through training the healthcare workers, improved vaccine storage, safe injection practices being promoted, and surveillance systems being implemented. These long-term improvements will help advance healthcare efforts in the campaign countries for years to come. Our One Shot, One Life Lions Measles initiative is what I really want to talk about. And in October 2011, a $5 million challenge grant was awarded to LCIF to raise funds for the Measles initiative by the Bill and Melinda Gates Foundation. For every $2 raised by the Lions, Gates will match with $1. This decision by the Gates Foundation represents a deepening relationship that started in 2010. Lions were chosen because of their global reach, commitment to health in the communities, serving the underserved, and a proven track record to change lives for those in greatest need. Now today, it's my great pleasure and privilege to report, as of last Thursday, the Lions have successfully met the Gates Challenge. We've raised over $10 million in the last year. In the past year, all across the globe, Lions came together in support of the One Shot, One Life. The Lions Measles Initiative by contributing an astounding $10 million to help end the death and disease of measles. The Lions' dedication to combating this deadly disease is a clear demonstration of our deep commitment to protecting the health and well-being of our most vulnerable children. We have shown the world that we're not only knights of the blind, but protectors of children as well. Our goal for 2012 is to vaccinate 157 million children in 2012 with our Measles Initiative partners. Now, how will this be achieved? Lions and LCIF have joined the effort to help vaccinate 157 million children during 2012. As partners in the Measles Initiative, LCIF will help these efforts by, 1, raising and providing the $10 million for the Measles Initiative, which we've raised. We're going to combine this amount with the $5 million from the Bill and Melinda Gates Foundation, to reach a total of $15 million. And we're going to do it by mobilizing and educating community members in measles priority countries about the importance of vaccinations and advocating for investment for routine immunization programs at the highest levels in all of these countries. The Measles and Rubella Initiative is a global partnership committed to ensuring no child dies from measles or is born with congenital rubella syndrome. The Measles and Rubella Initiative goal is to reduce measles deaths worldwide by 95% by 2015 and to eliminate measles and rubella in at least 5 of the 6 World Health Organization regions by 2020. LCIF and the Lions are proud to partner with organizations leading the effort to end measles. Together, we're making measles history. We will also continue to work on ridding the planet of other diseases. I'd just like to thank the Harry S. Truman Center for Governmental Affairs, University of Missouri, Kansas City, Mayor James, and UNICEF for hosting this session and allowing me to talk about the Lions' One Shot, One Life involvement in the Measles and Rubella Initiative. I also want to thank the other panelists for being a part of this afternoon, as we are all a part of United in Saving Children. And I thank you.
Well, thanks to all of you and my esteemed colleagues in service. I appreciate the opportunity to talk to you today and bring you a perspective on Rotary's involvement with UNICEF. So, Lynn, and nice to meet you too. Thank you. Let me start with maybe a little history, I think. Rotary started in 1905 in Chicago by a man by the name of Paul Harris and 3 other colleagues who wanted to do something more in the community. So they got together and decided to meet every week. From that single meeting, Rotary has grown into a worldwide organization. We have over 1.2 million Rotarians in over 34,000 clubs in over 200 countries in the world. We're very, very proud of our growth, although we do need to grow more. That was in 1905. In 1917, a man by the name of Art Clump decided that Rotary should, or actually he proposed to Rotary about having an endowment to do good in the world. And they approved that, and that endowment was started by, ironically enough, the Kansas City Club here in Kansas City. Contributed $26.50, and that started the Rotary Foundation. Isn't that fascinating? So that was in 1917. In 1928, they decided to change the name to the Rotary Foundation, and that endowment had grown all the way up to $5,000. So they changed the name to the Rotary Foundation. So the Rotary Foundation is the working arm of Rotary International, if you will. That's what allows us to do all the good that we can possibly do. So let me jump ahead now to 1979, and that's really when Rotary started to get involved with polio eradication. Rotarians decided to buy and help deliver some vaccine to some children in the Philippines. That was the first start. That was in 1979. Let me move ahead, and this is going to be kind of a rolling history lesson, if you will, so have to kind of bear with me. In 1985, and ironically enough, in the Rotary International Convention right here in Kansas City, one of the participants was Albert Sabin. Albert Sabin was the man who developed the oral polio vaccine. And he was there to receive Rotary's World Understanding Award. And in his acceptance talk, he talked and he challenged Rotarians to do something good like eradicate polio. Now, who would have thought eradicating polio at that particular time? So that was in 1985, and from that challenge, Rotarians decided to start a campaign called the Polio Plus campaign. I'm sure most of you heard of the Polio Plus campaign. I know Rotarians have. They're probably sick of the Polio Plus campaign. Not really. So the Polio Plus campaign at that time pledged $120 million to eradicate polio in the world. And at that time, that was the largest internationally coordinated private sector supported public health initiative ever at that particular point in time. So let me move on to 1988. 1988 is when Rotarians realized that they had raised over $254 million, over double that initial Polio Plus challenge. And at that time, there's more than 120 countries that are now polio endemic. So let me move ahead to 1991. 1991 is the last case of the wild polio virus in the Americas, which is pretty significant, I think. For those of us who grew up in the 50s, you were afraid to go outside almost in the 1950s because of the polio thing. 1994, the Western Hemisphere was declared polio-free. There again, that's very significant. In 1995, Rotarian volunteers and health workers immunized 164 million children in a single week in China and India. That's pretty significant. 1996, the number of nations declared polio-free is now near 150. Polio-free, 150. And the reported incidence is 85% less than it was in 1988. Moving on to 1997, the last case of wild polio occurs in the Western Pacific region. That Western Pacific region is from Australia to China, and there's some areas there that are huge population, huge countries, but that Western Pacific region is now polio-free. And that was the year 2000. Moving on to 2003, Rotary raises $119 million from its members in a 12-month campaign. The total contributions to this year from the word go is over $500 million. And there's six countries that are still pandemic. In 2004, synchronized National Immunization Day in 23 countries in Africa target 80 million children. That's the largest polio immunization effort on the continent to that point. In 2006, 4 countries are now polio endemic. We have Pakistan, Afghanistan, India, and Nigeria. And also, by this time, with only 4 countries still with this epidemic, that's the lowest number of reported polio cases ever reported in human time, I guess we'll call it that. That's in 2006. And in 2009, Rotary's overall contribution nears $800 million. And in January, the Bill and Melinda Gates Foundation pledges $355 million to polio eradication, and they challenge Rotarians to raise $200 million in a 3-year period of time. So you math majors out there, that's $555 million to go toward the eradication of polio in the world. That's very, very significant. In 2011, Rotary started this campaign called We're Just This Close, This Close. Many of you have probably seen that campaign where dignitaries and world leaders and celebrities are holding up their hands and they were just this close to eradicating polio. That was in 2011 when that campaign came out. And that was an effort to raise the awareness that we are just this close. We cannot give up yet. We are indeed just this close to eradicating polio. By this time, in 2011, the Rotarians' funding exceeds $1 billion, that's with a B, $1 billion that Rotarians have contributed to the eradication of polio. In 2012, and we're still in 2012, in January of 2012, India, the largest and most populated, is now polio-free. It had not reported a case of polio for over a year, so now they declared that polio-free. And who would have thought in 1985 that India would be polio-free? So that is something to really pat ourselves on the back about. Also in January of 2012, it was reported that Rotary surpassed the $200 million challenge that Bill Gates had thrown down at us. And since we met that challenge, he threw in another $50 million to eradicate polio. He's a very, very generous man, obviously. So there's a lot of money that Rotarians and the Bill Gates and UNICEF and the WHO have all put together to take care of polio. So let me move ahead to September 2012. Just not too long ago, if I'm right. Rotary has committed another $75 million to the eradication of polio. We are continuing the fight. We're not giving up. But we have pledged to the children of the world that we will not give up fighting the fight against polio, that nasty, nasty disease of polio. So let me give you, that was in September of 2012, just last month. So year to date, I'll show you how long this has been going. Year to date, we have 171 new cases of polio reported in those 3 countries left. Last year to date, was 467 new cases year to date. Now last year, there were 650 the total year last year. So we still have a couple months to go. So we hope 467 is the highest we get. Year to date, we've immunized 398 million children. Year to date. This week only, we've immunized nearly 20 million children in 8 countries in Africa. So we have men and women on the ground. Over a million men and women have spent their time, their personal resources to do National Immunization Day and to immunize these kids. So, Lynn, you are right. My latest information shows we're 99.5% polio-free in the world, which is very, very significant, very, very neat. The problem is that last 0.5%. It's in the poorest of the poor region. It's in the most remote region. It's in the most politically unsafe, socially difficult areas to get into. But if anybody can do it, we think the Rotarians can. We think with Rotarians all over the world and well-respected people can get in and talk to the religious leaders. We can show them what we really want to do. It's for the good of their own kids. So there are significant challenges ahead, but we are pledge to finish that job. Dr. Bruce Elbert, who's with the WHO, the World Health Organization, has said that without the passion, the perseverance, and the strong leadership of Rotarians, polio would be stronger than ever worldwide. That's a pretty good endorsement, I think, for anybody who knows anything about what Rotary does. So Rotary's commitment to polio has not changed. It is still front and foremost in what we as Rotarians want to do. There are many things that Rotary does worldwide. We developed the 6 areas of focus, and we've developed the mentality that whatever we do will be sustainable. We're not just going to throw money at something and pat ourselves on the back and think, boy, we've done a good job there. It has to be a sustainable project. We're very, very proud of that we don't just throw money at something. But the 6 areas of focus, let me tell you all what the 6 areas of focus that Rotary International has come up with. Number 1 is disease prevention and treatment. Number 2 is water and sanitation. Number 3 is maternal and child health. Number 4 is basic education and literacy. Number 5 is economic and community development. And number 6 is peace and conflict resolution. I've often struggled with number 6, the peace and conflict resolution. How do you go into a country that's generations upon generations of fighting with each other? But I think it boils down to, if you take care of the other 5, number 6 probably will take care of itself, probably. So that is really it for me. I want to thank my esteemed colleagues in service again, and Lynn, nice to meet you, and thank you, Jay, and thank